What's up, guys? This is Dr. O from Innovative Dental. Pleasure to see all your smiling faces today. I'm assuming they're smiling. They should be smiling, right? It's a wonderful day. So today we're going to talk about why you don't want your teeth cleaned. And you're probably going, man, I know that was clickbait. I clicked on it and you're a dentist and you're telling me why you don't want my teeth cleaned. That can't be true. And you're right. You should get your teeth cleaned. But I want to explain why I titled it, Why You Don't Want Your Teeth Cleaned. Because the number one question we get, or at least one of the main questions we get, first off, when you're a new patient, and it's understandable, but we get this question is, I'd like to get my teeth cleaned. And they want to have that done at the first visit, obviously for efficiency's sake. I get it. Everybody wants to not waste any time, doesn't want to go to the dental office more than they need to. And so they ask our front office, hey, can I get in and get a cleaning? And while that makes sense, truly it doesn't really take into one of the biggest considerations that I feel like a private practice or any dental office should be offering their patient. And that's truly a tailored and personalized care. And so you're a person, you're not a number at Innovative Dental. And so first off and foremost, we want to personalize our care. We can't do that if we promise and do cleanings at the first visit, because we haven't even met yet. So first thing we want to do is meet you, get to know you, know what you're about, know what your family, who your family is, see what is fun for you in your life. Find out, believe it or not, what kind of beverage you might like, because we make beverages here for our patients because we love our patients. So since you're not a number here at Innovative Dental, we want to obviously treat you as a person who has individual concerns. For maybe you have certain goals for your smile. Maybe you want to see your teeth straighter, maybe you want to see them wider. Maybe you've got some missing teeth and you're wanting to see what are the options to help replace and repair those missing teeth. That's something that we gotta learn and gather all that information. It's really hard to do all of that over the phone. We have an amazing team and they do a wonderful job gathering a ton of information before you ever come see us, and we send you a questionnaire and a survey that kind of helps us get to know you prior to coming in, but it's still not enough to really make that a tailored, personalized treatment. So I hope I hit that strong enough and you understand that our heart behind it is to not be inefficient. Heck, we make more money if we can do a cleaning in the first visit, an exam in the first visit, an x-rays in the first visit. Every practice that does that in that short, maybe hour typically, it's more profitable or more revenue that you can generate. But it honestly doesn't match our mission. And our mission is to create brighter smiles through innovation. And it's really hard to do that if we don't know who we're creating a smile on, why we're creating it for them, and what makes them tick. So hopefully that helps you understand that we want to personalize first the care that we give you, and we're gonna get to know you first. How about that? Our second reason is that, honestly, we don't know what you need as far as a cleaning. So it's understandable that if you're not a dentist and you're not familiar with dental care and all the different type of cleanings, you don't have maybe a hygienist in your family, you may not realize that there are actually many different types of cleanings. One being a prophy, which is, that's a short for prophylaxis. That's your basic cleaning. It means you don't have any gum infection or bone loss that is severe that's going to require us to do a deep cleaning or tartar buildup and bleeding, things like that. It also means that maybe the tartar is not so significant, we're not going to have to spend a lot of time removing it. Those patients that typically are within a 6-month cycle or a yearly cycle of getting their teeth cleaned, hopefully 6 months, but there's really no science behind that. That's a whole different topic. But if you're keeping the tartar off of your teeth and keeping them fairly clean, then typically a prophy is all that's necessary. If you haven't seen a dental professional, a hygienist in a while, that's not likely. You're probably gonna need full mouth debridement, which that's called FMD. So that's a second type of cleaning that we give. It takes more time, and to do it correctly, our hygiene, we have the best hygienist you're ever gonna find, I really feel, but that just takes more time to really clean those teeth, even doing it very quickly. And then the last type of cleaning, which is really important because it goes undiagnosed all the time because we get too quick to just clean teeth. So the third type is scaling and root planing. And scaling and root planing is short SRP is what we in the field call it, but it's essentially a deep clean. We go below the gums, we remove the tartar And you've probably heard it tartar, we call it calculus, that's below the gum line. We remove that because it holds bacteria that's affecting the gums and causing many patients to get bone loss. And so that's a whole different topic of how periodontal disease is a big problem in our population. But what if you needed SRP and you came in and you've been promised a cleaning and you get a regular cleaning and you really needed scaling or root planing? There's definitely a big problem there, because long term you might end up losing more bone. Essentially losing bone and gums might lead to tooth loss, infection around your teeth. So these are kind of serious missteps if we treat everybody the same. So that is why we want to take proper diagnosis to see that. Plus, let's say you've got lots of other conditions, missing teeth, you've got decay, you might need some crowns or some old fillings that are breaking and wearing down. We're definitely going to want to take x-rays and photos and proper records so we can see what's going on, and then sit there and be able to help discuss and co-diagnose with you at what are some of the options you might have to help remedy these problems. So those discussions, I know myself and Dr. Megan, our team, we spend a long time with especially our new patients, to make sure that we are thorough and don't just rush through that appointment just because we're trying to get a cleaning done. After we've gotten to know you, we've taken proper x-rays and records and diagnosed the proper cleaning that's necessary to give you the best health and long-term success with your smile, the last thing we want to do is we want to honor the fact that you work hard for your money, and it takes effort, right? I mean, it's hard we work hard. So we don't want to just throw it away or not have a clue what we're really spending it for, or not budget things so they're stressful. We've all been there where we've maybe committed to something that we didn't really realize was the commitment. And that happens all the time in dentistry. So we sit down in this special room actually that I'm in right now. We call it the Innovative Financial Room. And it's just essentially a time where we take concern and effort to help make certain that we clearly communicate the options for financial arrangements, understanding what things are going to cost and the investment that's necessary to remedy the problems, working with our patients on ways that don't put their families in harm's way and still lets them achieve oral health. And so that's the importance of that financial consultation. There's absolutely no way we can do that if we're doing a get to meet you, clean your teeth for 45 minutes, and then try to rush through explanation of what you need, and then maybe get to the financial discussion. And so you can see how an hour just doesn't cut it. So if you're trying to clean teeth. Now, we typically spend about an hour to get to know you, take the records, for the doctor to talk to you. Sometimes it runs over a little bit on an hour. And then we have about 20 to 30 minutes where our patients have a discussion with our financial coordinators. And obviously sometimes it's much shorter than that. Our treatment coordinators, financial coordinators, that kind of are synonymous in our office, but they may have a conversation for 10 minutes if you don't need much. But if you need a lot of work and maybe there's some, you need to finance some things, we go through all of that at that appointment as well. So, this is kind of a long drawn out way to get around the fact that I think a lot of people get dental cleanings or expect them from their new office, and they may not understand that they're not, if they're going to a place that is really going that direction of, hey, we're gonna clean your teeth the first visit, and doesn't have any sort of way to help customize and tailor care for you, I'd be concerned about the level of service and the level of care. And really, if you, from the very beginning, you're being treated just like another patient or another number, then you're not gonna get the best. And so we've committed to that. It's definitely not the most profitable for that first visit to do that for people, but it's the best way to create a relationship that allows us to give our patients the best smile. And obviously we make these videos for people locally to see, but this is gonna be on YouTube and Facebook, and I'm sure there's lots of people that can't come to Innovative Dental, or it would just be too much of a stretch to make that trip. I hope everybody finds this helpful and useful if you're searching. And if you're in a different state or area and you're going, hey, I've watched this video, I hope you would click subscribe. I'm into just educating as many people as we can. And so subscribe to the channel, and we'll be posting more videos that are hopefully helpful, educational, fairly entertaining at some points, hopefully. I don't know, I'm not really that funny, but that's kind of the goal behind it. So hit like, comment below, subscribe, and I look forward to seeing you in the next video, and you keep smiling.